Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a nephrologist talking to a patient named Laura Thompson, who has been recently diagnosed with IgA nephropathy, called Buerger's disease. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Thompson. Your GP referred you to me so we can discuss your recent diagnosis of IgA nephropathy, also known as Buerger's disease. How are you feeling today?
Honestly, doctor, I'm still trying to wrap my head around it. I've never heard of Buerger's disease before. When the GP mentioned it, I was shocked. I've always been healthy, and this seems so out of the blue.
I completely understand. IgA nephropathy can be quite overwhelming to hear about, especially when it's something unfamiliar. Let's start by discussing what it is and how we can manage it. Can you tell me about the symptoms that led you to see your GP?
Well, it started with me noticing blood in my urine a few months ago. It wasn't every time, but it was enough to make me worried. At first, I thought it might be an infection or something minor. But when it didn't go away, I decided to see my GP. They ran some tests, and that's when they found the problem with my kidneys.
Seeing blood in your urine, known as hematuria, can definitely be alarming. It's one of the more common signs of IgA nephropathy. Did you experience any other symptoms, like swelling in your legs or high blood pressure?
Now that you mention it, yes. I've noticed my ankles have been more swollen than usual, especially in the evenings. And during my last checkup, my GP said my blood pressure was higher than it should be. But I didn't think much of it at the time. I thought it was just stress from work.
These symptoms are typical of Buerger's disease. The condition involves the buildup of IgA antibodies in your kidneys, which can cause inflammation and damage over time. It's good that we caught it when we did. With proper management, we can slow down its progression.
That's a relief to hear. But what kind of treatment are we talking about? Is it medication or something more serious like dialysis?
The treatment varies depending on how advanced the disease is and how much your kidney function is affected. In your case, since we've caught it relatively early, we'll start with managing your blood pressure and reducing the inflammation in your kidneys. We'll likely prescribe an ACE inhibitor or an angiotensin receptor blocker to help protect your kidneys and lower your blood pressure.
Okay, that sounds manageable. Are there any side effects I should be worried about?
Most people tolerate these medications well, but like any medication, there can be side effects. These might include dizziness, fatigue, or an increased potassium level. We'll monitor your blood work regularly to ensure everything stays within a safe range. If needed, we can adjust your treatment plan.
That makes sense. I'm willing to do whatever it takes to keep this under control. But doctor, what does this mean long term? Will I need to take these medications forever, or is there a chance the disease will go away?
IgA nephropathy is a chronic condition, which means it won't go away completely. However, with the right treatment, many people can manage their symptoms and maintain good kidney function for many years. We'll also discuss lifestyle changes, such as reducing salt intake, eating a balanced diet, and possibly limiting protein, which can help reduce the strain on your kidneys.
I'll do whatever I need to. I just want to avoid things getting worse. I've read that some people end up needing a kidney transplant. How likely is that?
It's true that in some cases, IgA nephropathy can lead to kidney failure, which may require dialysis or a transplant. However, this doesn't happen to everyone. The goal of your treatment is to prevent that outcome. By staying on top of your health and following the treatment plan, you have a good chance of maintaining your kidney function for many years.
Thank you, doctor. I feel a bit more at ease knowing there's a plan in place. I guess I was just scared because I didn't know what to expect.
It's completely normal to feel that way, but remember, you're not alone in this. We'll work together to manage your condition, and I'll be here to support you every step of the way. Do you have any other questions or concerns?
Not right now. I just want to focus on getting better and staying healthy.
That's the right attitude, Mrs. Thompson. We'll set up a follow-up appointment in a few weeks to see how you're responding to the treatment. In the meantime, if you notice any new symptoms or have concerns, don't hesitate to reach out.
I will, thank you, doctor. I appreciate your help.
You're welcome. Take care, and we'll talk soon.
Extract 2, questions 13 to 24. You hear a GP talking to a patient named Mr. Foster, who has concerns about excessive hair growth. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Foster. I'm Dr. Stevens. I see you've come in today to discuss some concerns about your hair growth. Could you tell me what's been happening?
Good morning, Doctor. Yes, it's something that's really been bothering me. Over the past year, I've noticed excessive hair growth all over my body. It's not just in the usual places, it's on my face, back, and even my hands. It seems to be getting worse, and I'm not sure why.
That does sound concerning. You mentioned it started about a year ago. Have you noticed any particular areas where the hair growth is more pronounced or any changes in your routine around the time it began?
It's pretty much everywhere, but the hair on my face and back is the thickest. I haven't changed much in my routine. I thought it might be a reaction to something, but I can't figure out what it could be.
When did you first start noticing these changes? Has anything about your health or medications changed around that time?
It was about 12 months ago. I did start a new medication for my high blood pressure around that time, but I'm not sure if it's related. Other than that, nothing else has really changed.
Some medications can cause an increase in hair growth as a side effect, but it's usually more localized. Given the extent of your symptoms, it might be something more complex, possibly a condition called hypertrichosis, which causes abnormal hair growth in areas where hair is not typically prominent.
Hypertrichosis? I've never heard of that. What causes it?
Hypertrichosis can have several causes. It might be hereditary, meaning it runs in families, or it can develop due to other factors such as medication, hormonal imbalances, or even as a symptom of a more significant underlying condition. We would need to explore these possibilities to determine the cause in your case.
I see. Is there a way to diagnose it and figure out what's causing it for me?
Yes, we can start by running some tests. We'll likely do blood work to check for hormonal imbalances and review your current medications more closely. We might also look into your family history to see if there's a genetic link. Depending on the results, we can discuss treatment options that could help manage the hair growth.
That sounds like a good plan. I'm really hoping to find some answers. It's becoming difficult to deal with, both physically and emotionally.
I can imagine this has been challenging. In the meantime, have you tried any methods to manage the hair growth, like shaving, waxing, or other hair removal treatments?
I've tried shaving, but it grows back quickly, and it's really thick. I've also tried waxing, but it's painful and doesn't seem to last very long. It's like nothing I do helps, and it's affecting my self-esteem.
That's understandable. There are other options, such as laser hair removal or prescription creams that can slow down hair growth. However, these treatments are more effective when we know the underlying cause. If we find that the hypertrichosis is linked to your medication, we might consider adjusting your treatment plan to see if that helps.
I would be open to trying new treatments, especially if they could give me longer-lasting results. How long would it take to see changes with these treatments?
If we try something like laser hair removal, you may start to see results after a few sessions, but it can take several treatments to achieve significant reduction. Prescription creams can also take a few months to show noticeable changes. However, it's important to remember that the effectiveness varies from person to person, depending on the cause and the severity of the hair growth.
Okay, I understand. I'm willing to give it a try. I just want to feel like myself again.
That's completely reasonable, Mr. Foster. We'll take it step by step. First, let's run the necessary tests to pinpoint the cause. Then we can develop a treatment plan that suits your needs. I'll also provide some guidance on managing hair growth in the meantime to help you feel more comfortable.
Thank you, Dr. Stevens. I really appreciate your help. It's been a tough time, and I just want to find a solution.
We'll work on it together. I'll arrange for the tests, and we can meet again once we have the results. In the meantime, take care and try not to worry too much. We'll find a way to manage this.
Thanks, Doctor. I'll do my best. I'm looking forward to getting some answers.
You're welcome, Mr. Foster. We'll get to the bottom of this. See you soon.
See you, Doctor. Thanks again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor discusses a patient's significant improvement in asthma. Now read the question.
How are you feeling, Miss Taylor?
A bit drowsy, but much better than before. I can breathe so much easier now. I guess the inhaler is working.
That's great to hear. We adjusted your medication dosage, and it seems to be helping your asthma symptoms. You're good to go home now, but remember to avoid strenuous activities for the next few days.
Thanks. It's amazing how quickly this has improved. The last time my asthma flared up, I had to stay in the hospital for almost a week. This is a big relief.
Yes, inhalers can provide rapid relief. Just be sure to use it as prescribed. If you notice any issues, contact us immediately.
I will. It's just hard to believe how fast things turned around this time. I was expecting to be here for much longer.
The right treatment can make all the difference.
Now look at question 26. You hear a nurse educator talking to a group of nursing students about infection control. Now read the question.
When we talk about infection control, one of the key strategies is hand hygiene. It's one of the simplest and most effective ways to prevent the spread of infections. However, compliance rates among healthcare workers can sometimes be lower than expected. This is concerning because infections acquired in hospitals can lead to severe complications, particularly in patients who are already vulnerable due to underlying health conditions. Our hospitals' infection rates are actually below the national average, with only 2% of patients affected compared to around 4% nationally. But to maintain this, we need to remain vigilant. Regular training sessions, accessible hand sanitizing stations, and a culture of accountability are essential in ensuring everyone adheres to the protocols. Even a slight lapse in hand hygiene can result in an increase in hospital-acquired infections, so consistency is crucial.
Now look at question 27. You hear a physiotherapist discusses the rehabilitation plan for a patient. Now read the question.
Today, let's talk about Sarah. She's 3 weeks post-surgery for a herniated disc in her lower back. She also had some nerve compression, which was relieved during the surgery. This is her first time in rehab since the procedure, right?
Yes, that's right.
All right, we're going to start by implementing low-intensity laser therapy on the affected area. The goal here is to reduce the inflammation that's still present in her lower back and to promote tissue repair. This therapy will also help decrease any residual pain she's experiencing and improve her range of motion. Over time, you'll notice a gradual improvement in her flexibility and strength. Our aim is to restore her normal movement patterns without causing any further strain on her spine. Consistency is key in her recovery process, and this treatment is designed to facilitate quicker healing while minimizing discomfort.
Now look at question 28. You hear a medical professional explaining a diagnostic procedure to a colleague. Now read the question.
It looks like Mr. Anderson's wound is healing well after his appendectomy. Has his pain level been manageable?
Yes, he's been comfortable with the pain medication. I'm about to check his vitals before he goes to the ward.
Great. I've ordered some additional post-op checks. He had a slight fever earlier, which might indicate a possible infection. We need to keep an eye on his temperature and watch for any signs of redness, swelling, or discharge from the incision site. His white blood cell count also needs monitoring, so I want you to get a complete blood count (CBC) done twice daily.
Understood. I'll make sure the next shift is aware to monitor for any signs of infection.
Perfect. If anything seems off or if his fever spikes again, contact me immediately.
Will do.
Now look at question 29. You hear a medical professional addresses staff concerns about upcoming changes. Now read the question.
Now, you'll have received the email outlining the proposed changes to our electronic health record (EHR) system. I'm sure you've all been thinking about how this will affect your day-to-day tasks, and it's natural to have concerns. There's plenty of research showing how a more efficient EHR system can reduce errors and improve patient outcomes, which is why this update is crucial. However, I understand that the implementation process can be daunting, especially with everything else on your plate. I want to assure you that we've taken steps to ensure a smooth transition. We've scheduled additional training sessions to make sure everyone feels confident using the new system. And technical support will be available around the clock. Furthermore, we've adjusted workflows to minimize any disruption to your regular duties. Managers will be keeping a close eye on the situation to ensure that everything runs smoothly, so you can focus on patient care without worrying about system issues.
Now look at question 30. You hear a patient talking to a medical receptionist. Now read the question.
Hi, I'd like to book an appointment, please.
Sure. Who is your usual doctor?
Dr. Ahmed.
Is this something urgent?
Yes, I've been having chest pain since yesterday.
I'm sorry to hear that. Unfortunately, Dr. Ahmed is fully booked today, but Dr. Patel is available this afternoon.
I was hoping to see Dr. Ahmed since he knows my history. But do you think Dr. Patel could see me today?
Yes, she could see you today at 3 p.m. Or we could arrange for you to see Dr. Ahmed first thing tomorrow morning.
Well, the pain isn't getting worse, and I'm taking ibuprofen, which helps. Since it's related to a previous issue, it might be best for Dr. Ahmed to check it out.
Okay. Let's schedule you for tomorrow morning at
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on atrial fibrillation. You now have 90 seconds to read questions. Hello, my name's Dr. Sarah Miller. I'm a cardiologist, and today I'm going to talk about a common heart condition called atrial fibrillation, often abbreviated to AFib. Let me explain a bit about this condition. AFib is a type of irregular heartbeat, or arrhythmia, which can lead to blood clots, stroke, heart failure, and other heart-related complications. Many people with AFib might not even realize they have it because the symptoms can be mild or easily mistaken for other conditions. However, untreated AFib significantly increases the risk of stroke. In fact, it's responsible for around 15 to 20% of all strokes. AFib occurs when the electrical signals in the heart's upper chambers, known as the atria, become chaotic. This causes the heart to quiver or fibrillate instead of beating normally. This irregular rhythm disrupts the blood flow, which can cause clots to form. If a clot travels to the brain, it can block blood flow, leading to a stroke. One of the key symptoms of AFib is palpitations, or an irregular heartbeat. Patients often describe it as a fluttering sensation in their chest. Other symptoms include fatigue, shortness of breath, and dizziness. However, as I mentioned earlier, some individuals may not experience any noticeable symptoms, making regular checkups vital, especially for those at higher risk. AFib is more common in older adults, and the risk increases with age.
It's also more prevalent in people with underlying conditions such as hypertension, diabetes, or heart disease. Lifestyle factors can contribute as well, with obesity, excessive alcohol intake, and sleep apnea being notable risk factors. Interestingly, studies have shown that stress and even caffeine might exacerbate AFib symptoms in some patients, though the evidence is mixed. Let me share a case I encountered recently. A 68-year-old man named John came to see me after experiencing episodes of what he described as a racing heart and breathlessness. These episodes were sporadic, and he hadn't thought much of them initially, attributing them to stress at work. However, during a routine checkup, his primary care physician noticed an irregular heartbeat and referred him to me. After conducting an ECG and monitoring his heart over 24 hours, I diagnosed him with paroxysmal AFib, where the irregular heartbeat starts and stops on its own. John's case is a good example of why AFib can sometimes be tricky to diagnose. Because his episodes were intermittent, it wasn't immediately clear that AFib was the cause. However, once we had the diagnosis, we could start discussing treatment options. For John, lifestyle changes were the first step. He was advised to reduce his alcohol intake and lose weight. We also started him on a blood thinner to reduce his risk of stroke, which is crucial for AFib patients. When treating AFib, it's important to consider the broader impact on the patient's life. Many people with AFib live in fear of having a stroke, which can cause significant anxiety. Some patients may even limit their physical activity, worrying that it could trigger an AFib episode. That's why it's essential for healthcare providers to offer not just medical treatment, but also support and reassurance. Counseling can be very helpful for patients who struggle with anxiety related to their condition. In addition to lifestyle changes and medication, some patients might require more invasive treatments. For instance, if medications don't adequately control the AFib, we might consider cardioversion, a procedure that uses electrical shocks to reset the heart's rhythm. In more persistent or severe cases, ablation therapy, which targets the heart tissue causing the irregular signals, can be an option. Each treatment plan needs to be tailored to the individual, considering their overall health, the severity of their AFib, and their personal preferences. Let me also mention the importance of monitoring AFib over time. Even if a patient's symptoms are under control, AFib can still pose a risk. Regular follow-ups are crucial to ensure that the treatment is effective and that the patient's risk factors are managed. For instance, keeping blood pressure in check is critical, as hypertension can worsen AFib. Patients also need to be vigilant about any changes in their symptoms and report them to their healthcare provider promptly. Another case that comes to mind is a 52-year-old woman named Lisa, who was referred to me after experiencing unexplained fatigue and dizziness for several months. She had no significant medical history, but she was under a lot of stress due to her demanding job. Her initial tests didn't reveal anything conclusive, but an extended heart monitor showed that she was having episodes of AFib that coincided with her stress levels peaking. This case highlights the need for thorough evaluation, especially when symptoms are vague or attributed to other causes like stress. Lisa's treatment focused on stress management, which included counseling and incorporating regular exercise into her routine. We also discussed dietary changes, such as reducing her caffeine intake, as there was a suspicion it might be contributing to her symptoms. Although caffeine's role in AFib is still debated, in Lisa's case, reducing her intake appeared to help. In summary, AFib is a common, but potentially serious condition that requires careful management. Early diagnosis, appropriate treatment, and ongoing monitoring are key to preventing complications such as stroke. Patients need to be proactive in managing their health and should work closely with their healthcare providers to tailor a treatment plan that addresses not just the physical aspects of AFib, but also the emotional and lifestyle impacts.
Extract 2. Questions 37 to 42. You hear a doctor giving a detailed presentation on rapidly evolving landscape of healthcare. Now, read the questions. You now have 90 seconds to read questions.
Hi, I'm Dr. Emily Carter, and today, I'd like to explore the rapidly evolving landscape of healthcare, particularly how technology is reshaping patient care and diagnostics. With the rise of digital health tools, telemedicine, and AI-driven diagnostics, we're witnessing a profound shift in how healthcare is delivered. The future of healthcare is not just about curing diseases but preventing them and ensuring a better quality of life through continuous monitoring and personalized care. One of the most significant changes we've seen is the integration of telemedicine into everyday healthcare. Before the pandemic, telemedicine was a convenience. But now, it's a necessity. Patients can consult with their doctors from the comfort of their homes, reducing the need for in-person visits, especially for routine checkups. This shift has made healthcare more accessible, particularly for those living in remote areas or with mobility issues. The convenience factor cannot be overstated. Imagine a patient in a rural area, hours away from the nearest hospital, who can now get expert medical advice via a video call. However, there are concerns about the impersonal nature of telemedicine. Some argue that it lacks the human touch, the personal connection that is crucial in a doctor-patient relationship. I believe that while telemedicine does change the dynamics of patient interaction, it doesn't necessarily diminish the quality of care. In fact, it allows doctors to follow up more frequently and provide care that is more in line with the patient's lifestyle. The key is finding a balance between technology and human interaction, ensuring that patients still feel heard and cared for. Let's delve into diagnostics, another area where technology is making waves. Traditionally, diagnosing conditions has been a time-consuming process, involving numerous tests and specialist consultations. But now, with advancements in artificial intelligence, we can diagnose certain conditions much faster and with greater accuracy. Take radiology as an example. AI algorithms can now analyze imaging scans and detect anomalies that might be missed by the human eye, especially in the early stages of disease. This doesn't mean radiologists are becoming obsolete, far from it. Instead, they are evolving to interpret AI findings, making the final diagnosis more precise and informed by the best of both human and artificial intelligence. Cardiology is another specialty that's being transformed by technology. Wearable devices, like smartwatches and fitness trackers, have moved beyond counting steps. They now monitor heart rate, detect irregular heartbeats, and can even predict the likelihood of a cardiac event. These devices continuously collect data, which is then analyzed by sophisticated algorithms to provide insights into a patient's heart health. This real-time monitoring allows for earlier intervention and personalized treatment plans. Cardiologists now have access to a wealth of data that wasn't available before, enabling them to make more informed decisions and tailor treatments to individual patients. Now, let's talk about mental health, a field where digital tools are making significant strides. Mental health apps are becoming increasingly popular, offering everything from meditation guides to cognitive behavioral therapy exercises. These apps provide support to those who might not have immediate access to a therapist, helping them manage their mental health on their terms. But while these tools are beneficial, they should not replace professional care. The human element is critical in mental health treatment. Digital tools should be seen as supplements to, not substitutes for, traditional therapy. Finally, let's consider the role of genomics in personalized medicine. With the cost of genome sequencing dropping dramatically, it's becoming more feasible for patients to have their genetic information analyzed. This data can help doctors predict how a patient might respond to certain medications or what diseases they may be predisposed to. In oncology, for instance, this information can be used to design highly personalized treatment plans that target specific genetic mutations within a tumor. This approach not only improves the effectiveness of treatment but also reduces the risk of adverse reactions. So, where does all this leave us? My conclusion is that while technology is indeed changing the face of healthcare, it's doing so in a way that complements and enhances the human touch rather than replaces it. We are moving towards a future where healthcare is more proactive, personalized, and accessible. However, we must ensure that in our pursuit of technological advancement, we do not lose sight of the importance of human connection in medicine. The challenge for healthcare professionals will be to integrate these new tools while maintaining the empathy and compassion that are the cornerstones of good medical practice.
That is the end of Part C. You now have 2 minutes to check your answers.